Hello, good afternoon, and welcome. This is our last seminar for May is Mental Health Month, and we've had a little bit of technical problems, which may reflect the next the months that we have in the future, where we try to transition back to the face-to-face and the live presentations in this hybrid world. We're actually talking about that. We've all become so efficient with virtual presentations, and then we try to do this, in an actual meeting with people and try to accommodate both the virtual and again the need to be physically present, and it's challenging. So thank you all. Throughout the month, you've heard me talk. You've heard several of our staff talking about, mental health, talking about how we help children cope with some of the anxiety, especially as they transition back to school. Definitely we need to pay attention to this. I had an interesting conversation with some folks the other day about, this compound trauma and how our children really have been exposed to a lot of stress and a lot of trauma in the last couple of years, between obviously the pandemic, but also a lot of the natural disasters that we've all have endured and the changes in the loss of loved ones. I think that's a really important issue that we all need to pay attention to, grief. Um, Individuals have either lost somebody in their immediate family or know of someone that has been impacted by COVID and the loss of life. We can't forget that, including the loss of normalcy, of course. So, Fort Bend County, our partners with Dr. Mentor and our Health and Human Services Department, our HR department, risk management, our county judges office, our sheriff's office, and several of our other partners, the district attorney's office, probation departments, but we all come together to talk about these mental health issues on a regular basis. And looking at what do we need to do as a county to identify the mental health needs of our community and to come up with a strategy to address those. So we've all heard about mental health and emerging mental health needs. And so we're really fortunate that we have this commitment among county departments and county offices to really address this and to work on this collaboratively. So there's a lot of attention to the needs of first responders who are, those frontline workers, our EMS, our sheriff's office, and our health department. They're out there dealing with these situations all the time. So we've talked a lot about compassion fatigue, and we talked about vicarious trauma, secondary trauma, those things that we all have heard, and now we're really starting to realize how that impacts us. I think there was a presentation that we did, Dr. Profile and I actually started looking more at this compassion fatigue, and I thought about how it impacts parents who have had to be caregivers, taking care of their children and often taking care of their own parents. So I think the importance of compassion fatigue, vicarious trauma, secondary trauma, whatever we want to call it, we have to pay attention to it. And we have to pay attention to it now and in the future. A couple of years ago, we started work, we work very closely with our courts, and we started looking at like jurors. And you never think about that, but the impact of trauma on jurors. And people think, well, what do you mean? We just think they sit there for weeks. And Lieutenant Carter, who's part of this task force, actually was over the bailiffs in our courthouse, and also has coordinated our critical incident stress management team. But you think about jurors, they sit there, and then we send them home. and what do they do with all that they've heard and experienced during those jury trials? And then you think about it, I think the law enforcement and those people protecting the courts and those judges. Really important to think about how this can impact all of us. And then we have to think about our workforce. And I'm actually going to ask Randy, who's our new HR director, to come up in a bit and talk a little bit about this. Because we've had in our IT department, for example, who's had to step up to the plate on dealing with the vaccines and dealing with testing and dealing with elections and then dealing with creating this infrastructure so that we can all work remotely. And they had to do it quickly. And you think about the stress on those systems, and you think about the stress on the auditor's office and budget offices. That and again, I'm sure HR can talk about this better than I can. But again, those systems that we often don't think as first responders, but are critical to our operations, we need to pay attention to. So, and Dr. Minter, I don't think Chief Temple's here, so I'm probably going to put you on the spot to, we actually, we've been talking about this, and we've been talking about, why form a task force. We had a very tragic event in EMS a couple years ago, maybe 2.5 years ago, Dr. Minter, and we lost one of our leadership staff to suicide. And that creates a shock among all of us. It's like, how did we miss that? How could that have happened? What could we have done? So coming together, we really talked about that. What can we do to support those staff? And I think EMS has really done some really created some really creative systems and supports where they really use peers to, create a safe place for people to talk to. And Lieutenant Carter, I might have you talk a little bit about even CISM, the Critical Incident Stress Management Model, which again is based on using those peers to support those that are experiencing trauma. So there's a couple of folks. So risk management is also involved because, we have an EAP program in the county, and we want to make sure that we remove barriers to care. We talk a lot about that as a system, right? My staff always hear, what are the barriers to care? Why can't people get to services? Well, transportation. Well, let's see what we can do. Cultural issues, language issues. And then it's like, well, what are the barriers to care for our own staff? So there's been some progress in terms of EAP. And there's actually been some progress in terms of looking at specialized services for our first responders. Kind of what I heard is, one of our EMS or one of our CIT members might not want to be in the same hospital as somebody that they maybe brought in the week before. But really looking at those and being sensitive to those issues, the things that keep us from getting the care that we need. I want to share one experience that I had maybe about a year ago, and it's actually when we changed our HR policy and included a mental health day, right? And it was just to really encourage individuals, our staff, to take mental health days. In this recognition that mental health is part of health, clearly part of health. And so I had a call from somebody that works for the county, and I just thought it was so positive because he had just joined the county and he had struggled like with a bipolar disorder, but he was just so grateful that he was in a work environment that actually recognized that he could call and try to get care. And I thought just a simple action like that, which took some commitment from Commissioner's Court and from the county, that, maybe this young man was more comfortable in actually talking about his mental health needs and getting the care that he needed. So I think it was great. So I forget where I'm going, but we'll come back to it. So we've talked about this for the last couple of months, and so again, critical partners are the county judge's office, the sheriff's office, Health and Human Services, of course, HR, risk management, but it's not an exclusive group. And of course, we've added Office of Emergency Management also. It's not an exclusive group because, we know we want to focus on 3 areas, our first responders, our workforce, and our community. So what does that look like, how are we as a county going to have a strategic plan or to really address these mental health needs, the emerging mental health needs of our community? Not necessarily in terms of provision of services, but maybe guiding the services and guiding the system so that people can get the help that they need and they don't end up in our hospitals. They don't end up in our jails. So I'm going to turn it over to Dr. Mentor because you have to come up here, Dr. Mentor, because you have to stand behind that. But you're really used to doing that. Maybe you can talk a little bit just from the health department's perspective in terms of mental health, and also maybe some of the things that EMS is specifically doing.
So this is a surprise.
Yeah,
I came to sit right in the middle.
It's okay, Dr. Mentor. You do this, every Tuesday.
This is a surprise. Thank you for allowing me to speak and actually to listen though. So absolutely, I think one of the biggest things for me when I came to the county, and I wasn't here when the suicide occurred. I started, 15, 16 months ago, and that occurred in EMS before I started. So I don't have a lot of history with that. My history is COVID. I mean, that's basically a lot of it. But of course, with COVID becomes all of the stresses that were there for all of us, and that magnified what was bubbling underneath the surface in many, many areas for sure. So I guess the experience that I have is having seen people rise to the occasion quickly under enormous stress, collaborate across the county, and then see people also, as time went on, noticing that people were determined that there was going to be an end. And there was going to be an end about 2 to 3 months after COVID started. Well, those of us in health departments know that that doesn't, when we want it to end, it's not when it ends. We even I think we got a certificate and a little button that said, it was over. It's like, yeah, it's, we're getting there now. Now we can say that. But I think that's an extra level of stress when people anticipate an end and that end doesn't come. So the unexpected, whatever realm you're in, not necessarily an emergency, but anything can certainly cause a lot of stress. From the health department's vantage point, I know that when I walked in, Chief Temple was explaining to me what efforts would occur to specifically address mental health. Awareness is wonderful, but if you're not putting some action steps behind it, we can have these panel discussions all day, every day. We'll look at our watch 10 years from now because other things are going to pull at us and we still won't have addressed some things. And it'll take that next, unfortunately, not just our jails, not just our hospitals, but our cemeteries. We'll have more people that are victims of our inaction, of our indecision, of our just meeting like this. And honestly, I'm not complaining because it's my first meeting, but I do know I've been on these panels and I've been in task forces that don't have the intended results that we want them to have. So the conversation is a great place to start. One of the wonderful things that I've watched Chief Temple, Greg do in this past year and from before is actually put plans into action, going ahead and getting people, not just the peer support, but actually putting, resources behind having the chaplain be able to come on, in with his team and be able to actually log different time that's spent. We want to make sure that we're quantifying the need and we're quantifying how we address that need. And that we're putting some timelines behind it as well. So I applaud this group for what you're doing now, and I look forward to being a part of all that will be done in the future. I don't know if there's anything more specific that you wanted me to address.
Yeah, I think that's great.
Okay,
Yeah.
all right, thank you.
No, thank you, Dr. Mentor. And it's absolutely, and because we're still in those development stages, and I completely want to echo what Dr. Mentor said, because we need to quantify the need, and we need to, data. We need to address that need, and sometimes we plan and we talk, and we wait for somebody else to do it. Maybe that's been sort of the role in the past, because, somebody else is the provider, somebody else that. I think what we've recognized, especially dealing with this pandemic, is we need to step up to the plate. By taking that leadership, then maybe somebody else can then step in and follow up, expand, that we as a county need to step up to the plate. And that does take resources, and that takes money, and that takes staff, and that takes the right staff, which is really, really challenging. But Dr. Mentor, I think those are really, really important points about having to take action to do it. Thank you. Talking about taking action, Lieutenant Carter, can you come and talk just a little bit about kind of your background, and then bringing it over to Lieutenant Ellis, who now oversees our crisis intervention team, because that is an example where we have taken action and we've had really a lot of success with that. Thank you.
Apparently I'm a little too tall for this camera setup. You want me to squat, or can you? Here, will this help you? Oh, now you fixed it. I'm accustomed to feeling foolish, but not necessarily it going live the way it is right now. So from an action standpoint, I'm honored that Dr. Almeida would include me in that conversation. So she had asked us to kind of consider, as part of this task force, a couple of questions. And I really anchored in on the what have I done, was what she wanted from the mental health task force members. And here's a couple of things, and I don't want to talk in any length about this, but I'll keep it really brief. Is that I manage PTSD and generalized anxiety disorder, and I have a son who is diagnosed with a mood disorder. So it's very personal. It's in my home on a daily basis, and what troubles me is a bit is the phrasing. One, there's a stigma associated with it. Certainly in my subculture of law enforcement and the first responder world, it's not something we want to talk about. But the realities are we're over trauma exposed, quite frankly. So it's a real dilemma, and we need action to make things happen. And I think, if nothing else, my journey over the last 10, 11 years of just being open about it, I think is something that is incredible, because it means that nobody's a party of one anymore. And I know what the stigma's like, because I battled it as a party of one, and that's really a shame. We certainly have a suicide issue in first responder world. It's been referenced already with our EMS partners, and how that was brought to the forefront in a very difficult, challenging way. And you don't look at those things and pass by them lightly. It's, in addition to Mental Health Month, it's also Peace Officer Memorial Month, and we honor the men and women that are taken from us in the line of duty. But the reality is, I know more men and women that have taken their own lives that have died in the line of duty, and I know some personally on both of those lists, unfortunately. And so for me, it's really been about, what do we do about that? So there's two components. I do absolutely believe in an outward reach, and part of that is living with it with my son, and knowing how important that is. So the crisis intervention team is a project I'm very proud to have been a part of, from its genesis with the training side, to having an opportunity for a while to be the leader of the team, so to speak, and still work to provide that training to our first responder community, but also the peer piece on the critical incident stress management side, where we look at and know that we're a tough nut to crack when you look at first responders, just in a general sense. It's a very segregated world in many ways. And many don't understand our experiences because of what we normalize is really pretty twisted because of how frequently we see death and trauma. And so having peers that are there to support and kind of navigate that is a huge component. So putting a team together to help from a peer piece, it bled into, as Dr. Almeida referenced, into looking at jurors and the court piece and how traumatized some folks that participate in the court process can become. But specifically with first responders, knowing that we have these issues and trying to break down that stigma piece. So peer oriented, looking at connecting with the right mental health providers. We, as a task force, helped, particularly with risk management, reduce one of the big barriers, which is the gateway formula for the EAP, because EAP would route our first responders to clinicians that were available, not necessarily the right clinicians. And you start bringing first responder problems into a clinical environment where their background is dealing with perhaps maybe marriage issues or other less traumatic driven circumstances. All of a sudden you have a clinician and with a disconnect with their client, and if they even get through one session, that's a success, and they're looking at, man, this ain't the right fit for me. So you have first responders who avoided the clinical help that they needed simply because the barriers that were routing us into the mental health system. And I think one other is that disconnect of it's mental health and behavioral health, and the reality is it's just a health issue. And the sooner we start approaching it, including on our benefit side, where we have a health package, not a health and a dental and a vision, and oh yeah, somewhere in there is behavioral health. The sooner we close those gaps, I think we'll start to see. But for me, from an action point, I work, and I know she's referenced already Lieutenant Ellis, who's going to come up and illustrate how we're doing it in a very specific way with outward reach. But while there may be lines in how we organize these things, the realities are we're working in concert behind the scenes, even if we say one is crisis intervention, which is outward reach, and then that critical incident stress management, which was the in-house portion of trying to take care of our first responders. We have these partnerships. Dr. Connie and I have worked together many years, 10, 11, 12 years. It's hard to track that. I don't have that date written down, but there is a concerted effort. It's a slow effort, but know that for me and the folks that we work together, it's an unyielding effort. We are not giving up, and to try to make those impacts and leave the systems better than when we came into them. So I'm hopeful that if anybody looks at, well, what have I done, as we were asked to kind of consider, is I hope that mark of we're leaving today better than we were yesterday, and tomorrow's another opportunity for that improvement to continue. So I hope that hits what you were looking for, Dr. Almeida. Do you want to ask anything before I step away? So this is it.
Yeah, we might.
All right, I'll stand by. Thank you very much.
Thank you. Thank you, Lieutenant Carter. Kind of lessons learned in this work that takes it's really taken a long time. One of the things that I've learned really from our health department and our response and the need to respond from COVID is how you can respond efficiently and quick and make a difference. I think Fort Bend County Health Department has done an amazing job with, the vaccines. So it's really impressive to hear, the percentage of individuals, especially on individuals over 65 that have been vaccinated. But what I've also leveraged is how the technology, the IT piece of that has really supported that in terms of, the decision making and the data analytics. So I'm like, oh, Power BI, which I never even knew what that meant, but I'm like, why can't we use that for looking at criminal justice or looking at, court orders and understanding, who's coming into the jail. So obviously I've leveraged that. And I think, really had this kind of great discussions with IT about using that technology developed for something else to help with other processes. And so I think there's always an opportunity to say, okay, we really have been slow on the mental health side, I mean, in terms of our response system. We really have not put in the adequate resources that are needed. Except for CIT. We'll talk about that and some of the successes there, but how we did that and really can, again, leveraging not only our partnership with criminal justice, but our partnership with healthcare and then having a data-driven system. I think that's a perfect example of how things can work when they are driven by data. Lieutenant Ellis, thank you.
Sure.
I'm taking notes too because I'm learning.
Great.
It kind of helps.
So thank you for the invitation and thank you for your attention. Just to share brief information, the history of CIT, the impact of CIT was driven by many men and women that had stake in the development, the coordination, and the partnerships that took place in the development of such an amazing team. Crisis Intervention Team is a team that reaches our community when an individual of our community has reached a place where their coping strategies they are not working, and there's a crisis, where we need to take effect and maybe even remove them from their freedoms to get them into stabilization in an inpatient facility. Amazing work has gone forth and allowed me this recent opportunity to have the baton passed to me, as if it were, in leading the team. So a couple of key things, though, I wanted to kind of make sure I stay on topic as far as, how can we help, what do we do, and how do we partner in a task force, if it would be, what are we doing in that place. One of the things that we've continued is training for officers. The training is mandated in some places, and in others it's voluntary that can give continuing education hours for officers for their licensing needs and requirements. And what we've done is we've taken components and modules where we partner with behavioral health, other organizations, outside organizations that deal with mental illness, developmental issues, autism, things of that nature. And we fastened those pieces into the training for new cadets and for the officers that are already helping to support the first response needs of this community. So those are some of the things that we've gently, with approval, put into place so that we can introduce those ideas of stigma, coping, identifying compassion fatigue. Let's just figure out what that is and understand if that's something that we're going through. And then we have those times where we introduce opportunities to connect with EAP, CIT, CISM, and those are some very important key partnerships and things that we want to maintain. I had wrote some notes down. So we train many of our staff in de-escalation and trauma-informed care, and we have to kind of sneak in those pieces of identifying those strategies for coping as we do the work and after we do the work. So what do those first responders do as they do the work? So we identify how to help someone else, but how do we identify when we need the help? And then what do we do after we've identified that? So those are some of the things that we're working towards. Again, like Dr. Almeida shared with us, we collect data and have been blessed with the opportunity to share some of that data with them for analysis when we're helping community members. Of course, it's very sensitive as far as employees or things of that nature, so we don't have that data. But just seeing the trend and knowing that there are some special needs to be met, we go and do outreach. So the outward piece, as Lieutenant Carter said, CIT, we've shaken hands with programs like Honor Strong through Cypress Creek Hospital. They have specialized and certified individuals that deal with first responders and first response. If anybody knows, well, if you know the personalities of a law enforcement official or anyone that is in this type of first service type of work, they're used to going and controlling things and not being in an environment where they're being controlled, or their ideas or their desires are being controlled. And that's a very sensitive issue. So we collaborate in the best way that we can to make sure that if there's a first responder in need and that need is urgent, that we can usher them into care and provide some safety for their information and for them. And then we're on the tail end right now of some discussions with our administration on how to make that information confidential so that these individuals can return back to work and not have to face the stigma of, access to documents that would show, what they were dealing with, what they were going through. And that's working. That's working. So I'm happy to report that. But we're here as a definitely a team member for not just the involuntary pieces, but the discovery pieces. How can we get this better? Those continuous quality improvement pieces that we want to share information and be a part of the problem solving when it comes to how CIT can fit in a concerted effort like this. Anything else you want me to really key in on? I didn't want to go through the whole history of CIT, but we're definitely here. Yeah.
We'll have some questions.
Okay. I'll get out the way.
Thank you, Lieutenant
All
Ellis.
right.
I was actually trying to pull up, Dee, do you remember, where are you, Dee? Oh, how many, what was the data we pulled up for CIT? Since, yeah, was it
Well, it was at 15,000.
15,000 since October 1st, 2014, which is when we started collecting data. So that's pretty remarkable. Those are total contacts, and then we also track unique individuals. We track if individuals have Medicaid insurance. We track what their disposition is, where they go, what's involved. So we have this amazing wealth of data. We'll have to use Power BI to analyze that. But, now that I know what Power BI is, but a part of this is that often in our systems, we do have a lot of these data, but what do we do with it? And how, I can sit there and love to look at all these variables, but, people just look at me and go, what does that mean? So truly, when you look at other systems like Power BI and creating these dashboards where, folks can look at something and then dig deeper into what happens to an individual. So for example, we track whether CIT responds to a juvenile. That's like a whole wealth of data that we've never even looked at. Like who are those? What happens to those kids? Do they get connected to services? Do those kids end up in the criminal justice system? Think about it. Now we have data from 6 years ago, almost 7 years ago. What's happened to those kids? Guess that's my next phase in life, but I just overwhelmed myself thinking about that. But so I wanted to mention, and I think Chief Tempo's actually linked in through the WebEx, so we might give him an opportunity to talk if he's available. So again, about partnerships, so work very closely with the Sheriff's Office, worked very closely with Health and Human Services. We actually, a couple of us are part of the national, I can never remember what we are, the National Leadership Academy for Public Health, which is actually Ben, and Dr. Minter, how do you pronounce this? It is Safi. Oh, okay, I got it. Yeah, who's actually the deputy chief for Fort Bend County Health and Human Services. And Ben's amazing. I think he's been with the county for a year. And the fact that he has had the time and the commitment to pull us together, again, a very diverse group. So Lieutenant Carter, Caroline Egan from OEM, myself, and Ben are a part of this national group, which is also focusing on mental health. So I'm actually going to, Caroline? Yeah, because Caroline's sort of the new partner in this. But, Caroline, that works for our OEM office and actually coordinated the Fort Bend Recoverers group. So again, it's kind of this group that's developed to deal with get the recovery phase after a natural disaster, but how mental health is actually such an important piece to this. Caroline's also our note taker and the one that's very organized, so we're very appreciative of her on the group.
Thank you, I appreciate that. Well, good afternoon, everyone. Again, my name is Caroline Egan. I'm with the county's Office of Homeland Security and Emergency Management. I'm the disaster recovery manager. And so whenever a disaster happens, afterwards, anything recovery related, especially when it comes to our residents out in the community, that falls to me to help coordinate that. And recovery is a huge beast to tackle. And so obviously I can't do it alone. I have my coworkers to rely upon, but definitely there's a lot of really great organizations and community partners that we work with. And so with that, we have a long-term recovery group in the county called Fort Bend Recovers. And our goal is to really work to address the short-term and the long-term recovery needs that our families, our individuals, and our businesses have to get them back to a place where they're even better than where they were before the disaster hit. It is interesting, Fort Bend County, you know, in the emergency management world, we kind of brag about the number of disasters that we've dealt with. That's not really something you really want to brag about, but that's what we do. So we've had quite a few in Fort Bend County. And after our first kind of wave, we had, you know, 1 in 15, we had 2 big flooding disasters in 16. And that's right when Fort Bend Recovers started. And as part of Fort Bend Recovers, we have a behavioral health, a mental and behavioral health work group. And it's a lot of different nonprofits that have come together to really try to get the message out to the community to say, we have resources to help you with any mental health or behavioral health issues that you're coming across. And knowing that it's not like you need to go sit with a licensed professional, you might just need to sit with someone just to hear you talk. You just want someone to listen. But we found that after our disasters in 2016, people didn't really want to reach out. They were more focused on other things. If I could just get my kitchen cabinets in, I would be fine. My house is on the road to recovery. We're like, well, no. There's some other issues here. Let's talk about it. And people just were not interested. And then Hurricane Harvey hit. And slowly but surely, more and more, we're seeing people make that connection of, I'm under a lot of stress. Navigating recovery is very difficult. I need help with this. And it's not just someone to point me in the direction of who's a good contractor to get my floors replaced. It's who is out there that can help me with coping strategies, or just someone to listen to, or to be like, hey, you might, as we've been going through with Fort Bend County so many disasters, there might actually, I don't throw this term around lightly, but PTSD. And our residents are actually experiencing that. And then COVID. And we're starting now, again, more and more. Now we're having parents reach out to us, be like, I don't know how to talk to my kids about mental health now. I need help. And so in a way, it's encouraging that our community is now recognizing the gravity of mental health issues. It's really unfortunate that it took disasters to get to that point. But that's where we're at. And so and again, it's great. But as Connie was mentioning, being part of this little public health leadership team, it's really opened my eyes to all the other aspects of it. I have a tendency to just be like, disasters, people in the community. And I'm like, oh, wait, there's other people too that help. So being able to provide a lot of these resources that are there to our community, and knowing that we have other partners out there too. I know we talked about a lot of the really great collaboration among county departments, and that is really great for our first responders and our workforce, but even going a step beyond, knowing we have a lot of other partners that are out there who so desperately want to help. But unfortunately, with mental health, you can lead a horse to water, but you cannot force it to drink. And that's really where we're at. And so just trying to, as we've mentioned, the stigma, trying to overcome that and create that safe space for our residents and our disaster survivors to get the help that they need. I'm trying to help make those connections and get that out into the community, and being part of this group and this team to really kind of come up with new resources and new ways of doing that is really exciting. It's definitely challenging, but that's where we're at. So.
Thank you. Yeah, I know, that's great. When you were talking, there's a couple of really points that I want to emphasize. Because what Caroline mentioned was people after a disaster, they don't need the licensed therapist. They need somebody to put food on their table and fix their roof. So our social services department, critical piece in responding to that. So it's really interesting, like when we're trying to set up these systems and we set up a mental health system, nobody comes to us because we're not thinking, that's not it, right? But all of a sudden we'll see them coming in through our social services department. So I think it's really important to think about, how do we create, the term intercepts is probably too technical, but it's like gateways to care. Not sitting in our office waiting for people to knock, going, oh, I have a bipolar disorder. That's too late. But, when they come in asking for food, kind of being trained and kind of asking what is going on? Who's taking care of the kids? How are you dealing with all this? Where are you sleeping at night? Great question. If you ask people that, you can get such a good picture of what's going on in their life. If they're couch surfing, if they don't have a safe place to sleep, I can bet you that they're not doing well. They don't need a diagnosis. They need that to be addressed. But I just wanted to mention that because that was, those social determinants of health, really, really critical. I think you all might know this. I know Dr. Minter does, CDC came out with this a couple of years ago, and I was just fascinated because it had data. It was like basically, I don't remember if it was 70 or 80% of health outcomes are actually somewhere around there, are actually due to social determinants of health. Things like having access to healthy food, having a safe, consistent place to live, having access to medical care, having social supports. Those are your major determinants of health, right? Specialty care, I think accounts for like 20% of health outcomes. And then when you think about how much money actually, I'm going to get on my spiel, but it's an important one. If you think about how much money is actually put into those social determinants of health, which clearly we have data account for most of the outcomes versus money that's put into specialty care. Anyway, and unfortunately, we've seen this with the pandemic, and we see this over and over again. We see this in criminal justice. I think we're going to see it in school and children struggling with learning, that are most vulnerable populations, those that are poor, those that don't have access to services, are the ones that are disproportionately negatively impacted by these issues. And we, there was a great slide that, what was it kind of, making, we think, okay, everybody should get the same amount of services and supports, equal. Equal is not equity, because we have to be intentional in how we design systems to really make up for that disproportionality, those discrepancies that, again, some of our most vulnerable populations have experienced over time. So that was, I think it's just an important issue that we, again, have to pay attention to, and not just talk about it, as Dr. Minter said, but really do some action. I wanted to mention, because again, Caroline mentioned some really good points, kind of those non-traditional supports. And I don't know if, can Chief Temple call in yet? I think he was having, but as Dr. Minter mentioned, what they set up within EMS was some of those non-traditional support, really building on the chaplain and in those peer supports, which again is the basis for the critical incident stress management. I would say Lieutenant Carter and Lieutenant Ellis, if one of your co-workers although I have a good relationship with them, but
Yes.
they're going to feel much more comfortable with you. They're probably not going to go to our EAP program right away, right? So I think that was a really important point. And I just had a note in, and then Randy, I'm going to ask you to kind of come talk a little bit from HR. But Dr. Minter mentioned a really good point about So, you know, everybody was like, oh, we're going to deal with this pandemic for a couple months and then there's going to be an end. Sometimes we think about that as mental health. Oh, we've already gone through the worst. There's going to be an end. Now I'm surprised Caroline didn't talk about this, about PTSD. And when we actually start seeing some of the negative impact of these traumatic events is actually 6 months, a year, and even longer. Children are going to be returning to school. That is going to be a stressful event. So, you know, what that is going to trigger for our children, we need to plan for and we need to address. Some of them will not want to go to school. And, you know, some of them might be afraid that if they go to school, mom or dad might die, you know. So I think really we need to be aware of this. Safety, I love that word because that's like one of those human needs that we all need to have is to feel safe. And then you think about how many of our children don't feel safe. You think about how many of our first responders, especially these days, don't feel safe. So, you know, it might be in that constant hypervigilant mode and the energy that takes to be constantly hypervigilant, watching, you know, fight or flight mode. You're going to address safety, Randy? Is that an HR issue?
I can do my very best.
No.
Hi, everyone. My name's Randy Littner, and I'm the HR director. As mentioned, I'm the new HR director. I started in January, so I've had a really fun initiation this year and happy to be here. I'll try to answer as many questions. Risk management does primarily handle safety, but I can take any questions and answer it as best as possible or get to the best answer. So we'll focus on, you know, the workplace and human resources. And I think that that's the really most important piece that I always remember is the first word of the department, which is human. And so, you know, this would be easy if we all only worked with, and I'm going to Google this later, Power BI and just the data and the computer side. But behind all of that, there's these stories and there's people and it's the events and, you know, it is this compound and it's, you know, what's happening in everyone's world. And, you know, then it comes into the workplace, right? And then all of a sudden you have little things that happen in the workplace. And then you have these big things that happen in the workplace and the things that you're doing, you know, on the ground. And, you know, next thing you know, you can't find a piece of paper and, you know, you snap. I mean, that happens. That's a real thing, right? And so, you know, this compound issue and just how our lives are working and how that intersect with work, can be very problematic. And so as it relates to providing so many support structures around our social system is where really I'd like to hone in on, you know, any policies in addition to really leaning in to those wellness days and your vacation and sick time and using them for wellness purposes. You know, not just how many of us have taken a day off to get our car oil changed and, you know, I have to do this appointment and that appointment. How many times have we taken a wellness day off to go talk to someone or use one of these great resources that we have? Or some of the, you know, other resources in your life, your churches or your church groups, or called on a friend that you haven't, you know, checked in on in a while. So, you know, truly those wellness days, you know, it's a great policy and I'm so glad that, you know, we've leaned in on it. Make sure you're not using it to just, you know, do some more dry cleaning errands and, you know, the car check-in. You've got to commit that to yourselves, okay? We can make policies all day long, but really they need to be socially supported. And that includes all of us. And, you know, that's a compassionate mindset and a mindset that really understands what we mean by stop the stigma, right? And so if someone needs to leave early for whatever their reason is, you know, we don't know what goes on in everyone's life. And we, you know, we care, but really, you know, if it is to run a dry cleaning errand, that errand and, you know, leaving early to do that might have been the straw that could have broken the camel's back, just like, you know, needing the piece of paper in the office. Sometimes those 15 minutes, I don't know about you, but sometimes for me, those 15 minutes are the stress relief of a lot of things, and I see some head shaking in here, right? And so in the workplace, we can have these policies, but it's also just the social support and compassion, you know, that we give each other every single day with every interaction. Some things that I think our leaders can do, and then all of us around it can support, is having meetings, being there. You know, now that we're back face to face, let's get in touch with people and have a portion of those meetings maybe set aside for some softer issues. I'm not suggesting to go into a mental health session. Those, you know, really should be separate from items like that. But I would talk about what mental health resources are available to us, not only as employees, but as a county. All right, what does that look like? And we've had a whole month long webinars that I think, thank you, Dr. Almeida, to you and your team for delivering those. They've been wonderful. Yes, you're welcome. Will those be available? Okay. Great.
Yeah, IT's taken care of.
Oh,
Yeah.
we love IT. God bless IT. Well, so it's not a one-time event that we're just going to hear that information. And so you can always reference those for your departmental meetings. But getting back to that face-to-face, don't we all miss each other just a little bit? I think just a little bit. We have this, you know, desire for human connection at some level. Now I'm HR, I'm going to say that. Again, it's that human piece. But even those introverts still have, you know, some type of connection with human interaction at some point. The recognition piece during those meetings. I see you. Thank you so much for what you've done for children and families over the last forever, but in particular the last year. I see you. Thank you for all that you do with CIT, right? I mean, really hone into that and be specific. I see you. That feels so important. And I hope someone in here besides me just got goosebumps, because that's an endorphin and that feels pretty good. And it feels good to even have a nice moment when we're dealing with so much stress. So I highly recommend a meeting, get together, add a component with mental health awareness in it at some level that's right for you and your team in some way, shape, or form. Ask the team what they would like, okay? Put a piece of recognition in there. We all deserve it, and it feels so good. Those endorphins, we love those. And then I'd highly recommend one-on-ones. You know, again, you know, leaders, this is really for you. You know, those are special times, whether it's 10 minutes, 15 minutes with your folks, to just let them know, hey, you are doing a great job. I see you here, and you know, you're not just coming and going, but there's special time, because we've all been dealing with all these issues that OEM just talked about, and you know, all of these massive problems. But I'm still just an individual and a human being, and whether it was the fact that I chipped a nail or my friend committed suicide, those are all very important things. And on any given day, I may need to talk about them, you know. And you know, from a work perspective, often our social network is our work, okay? And HR, you know, we try to go, okay, you know, your personal life is your personal life and work is work. Well, I'll tell you, over the last few years, that's gotten real close, all right? And so, you know, we can't just compartmentalize those things anymore. It's not fair to ourselves either, and the people that we work with and are around. It does affect your performance too at some point. And we are seeing a little trend in that in HR, where we're having a little more workplace conflict, a little less patience with each other, whatever it might be. Some of those items are big, some are very small. But small to me might be a very compounded issue to you. So again, you know, make sure that you understand your role in someone else's life as well, even though you might work with them or just work with them, you're going to see most likely a lot more than what you think into someone's life and what they might be going through mentally and emotionally. Some things to look at are attendance, changes in performance, someone being a little more withdrawn. Those are all, things that are just common. I'm not a doctor, and I'm not as specialized as many of you in this room and around the county, but those are things that I just see in my own friendships and family that I would do something about. And so, I hope that as we lead with compassion and care for those that we also work with, that, you feel comfortable going to your leaders or human resources or whomever your folks are most comfortable with and go, hey, I think Randy's going through something, and whether it's affecting work or not, I would hope that someone would do that for me as well. Okay. Because we just don't know what's on the other side of it. Often in HR, what we get is they're just doing a bad job and, they're not doing their work. We have no idea what's going on in their life. And usually it's someone just spending a little bit of time with them to figure some things out and get some folks back on the right track. That's what normal typically looks like. And we need to also understand what normal doesn't look like, which are some of these things like, I know my coworker is sleeping on someone's couch, or, they've been late they used to be on time and now they're late all the time. So these are just patterns of behavior that you'll want to look at. I encourage lunches and laughter again, now that we can get back to, kind of socializing with each other a little safer if you're vaccinated. And there's ways to, get together if you don't feel comfortable in those social settings. We're doing it right now, and we all hope that we're connecting with our audience. So this won't be a one-time event. We'll still use technology quite a bit. So that's here to stay in one way or the other. And then I'm just going to challenge everyone. Here's my challenge. Say hi in the hallway. How you doing? How's your day? Smile and just kind of do that. I promise you're going to breathe a little bit more. And you might just literally be the thing that makes someone's day. Be that difference between the straw that breaks the camel's back and otherwise. We hope to continue to look at policies that support everything that I'm saying on the social side, including leaning in on the wellness days. We look forward to being a greater part of this task force, and we don't do it alone. Your ideas will help us. We are a role model for all of our community and the surrounding communities. They're looking at us to go, okay, what's Fort Bend County doing? So thank you for all on what you do. My last piece here is just, we're the people that take care of people. And so, there's a high level of pride and just ego involved in that. And that's not a bad thing. And so, I can say I've had a close friend who had all the resources in the world, was a doctor in mental health, also take his life. And so, we can't ask him why, but I can't help but to think pride probably got in the way of reaching out. And so, again, keep in mind, those around you, those are your people. That's your squad, your tribe, your crew, and those often are your work folks too. So thank you for all that you do and taking care of yourselves first and then others second. Are there any questions for Human Resources?
Thank you.
A pleasure to be here.
Okay. I don't think I can add anything to that. It's 1:05. Thank you, Randy. You reminded us of several important things about compassionate and taking the time to connect with individuals. And I don't know why I always thought meetings had to be an hour. I'm like, really, if I can just make it 10 minutes, then I can connect with, the staff. And why an hour? Why was it always blocked for an hour? Which made it not possible. But thank you really for reminding us of such really important points. this is over 5 minutes ago, so I know we had Chief Temple on, but I don't think he was able to connect. Okay. So, we will continue these discussions. This task force is just in its infancy. We started talking about this, it's like, who needs to be at the table? It will formalize in the next couple of months soon. I'm going to remember what Dr. Mentor said. We need to take action. I think the next couple of months are going to be very challenging for all of us. And again, how do we support our workforce, ourselves, and then how do we look at supporting the community? This was amazing. I mean, you all just, emphasize the importance of this is about health. Let's not talk about mental health versus physical health. Let's really talk about, how do we create a system where people feel safe, belong, safe to reach out and not be judged. And, that importance of compassion and self-awareness about, where it's just too much for us. We need a break. We need to take a break. Whatever that looks like for you, self-care, but need that break, need that 15 minutes, go home early. Yeah. So thank you all, and amazing presentation. I don't know how we do this at the last minute. It's like, okay, we're doing this tomorrow. Show up. Here's the ideas. But I think that's what's so reassuring is that we all are on the same page. And so, thank you.